So her ongoing mission, because it is an ongoing mission for Dr. Cardash, it has seen her being rising to the position of medical director for the Maccabi Kupat Cholim in Jerusalem and the Shfela regions. And in this position, she is responsible, these numbers are astounding, for 1,500 doctors and 600,000 patients. I mean, to me, those numbers are frightening, but I'm sure to Dr. Cardash, it's something that she handles with absolute professionally and with ease. She also works very closely with Nefesh B'Nefesh, which helps people to facilitate their Aliyah. And she has created for Nefesh B'Nefesh a guide to actually navigating the Israeli healthcare system, which she has presented over the last 21 years to innumerable, countless potential olim, immigrants seeking to make Aliyah or who have made Aliyah, at Nefesh B'Nefesh Aliyah fairs, and also to new olim immigrants in the community. Dr. Cardash is now the go-to doctor, and often the Aliyah counselor, not only for her patients in her huge catchment area, but also for olim immigrants in general, and of course other medical professionals excuse me, who are seeking to make Aliyah themselves. So I think without further ado, I shall hand you over to Dr. Tanya Cardash, who really, is the embodiment of the Zionist dream and who has succeeded in making a significant contribution to the state of Israel. So Dr. Cardash, it's my honor to hand you over the virtual floor, so to speak.
Okay, well, thank you very much for the introduction. It's great to be here with you this evening. And I'll repeat, I hope you're all staying well and you're all looking after yourselves. I'm going to talk to you a bit about the healthcare system. I'm just going to actually share my lecture so you can actually all see it. Okay, so hopefully you can now see the lecture. Now, what we've decided would be the correct thing to do is if I will present you the lecture, and then afterwards I will leave time to answer questions. It's important that the questions that you ask me are general questions about the healthcare system and not go into your personal details about specific medical conditions which you may have. I will provide you and will write in the chat box at the end an email so you can be in contact with me if you have any personal questions or you want to check things out near to the time where you're making Aliyah. So I'm going to start. As you probably can hear from my accent, I was born and bred in England. I grew up in Kenton, and I went to medical school, University College London Medical School. And at the age of 24, having finished medical school and my house jobs, I came to live in Israel. So let's get going. Hang on. Okay. So first of all, to give you a little bit of background on the Israeli healthcare system. Now, very often there are surveys that have done of the healthcare systems in numerous countries of the world, and it enables us to compare basically how the countries rate in terms of their healthcare. Now, when these rankings are done, they're not normally done every year, they're done every few years, and it's based on also the mortality and morbidity in the country, but there's also an indication of what proportion of the country have healthcare coverage, and also the waiting times for access to medical care and the affordability of drugs and operations and things like that. So in 2018, in a survey of 48 countries that was done by the World Health Organization, Israel was actually ranked 4th in the world in the terms of efficiency, which was something which was quite impressive. One of the reasons, and if there's time afterwards, maybe we'll speak about it a bit, one of the reasons why the system in Israel is very efficient is because we have a universal medical healthcare record. For example, it means if my patient goes from my surgery to the emergency room, In the emergency room, they won't see the full notes of what I've written, but they will see the patient's blood tests, medication record, diagnoses he's got from me, and other recent imaging tests. So there is a transfer of information. And in the reverse, if I have a patient who comes to me tomorrow morning in clinic and was in the emergency room last night, I'll actually be able to see the full summary of his emergency room visit. So that makes the system be very efficient, because it means we've got a real-time, basically, transfer of information between the community medicine and the hospital medicine. Now, again, there was Bloomberg Rankings, which is something which is known more to the American public. The Bloomberg Rankings are something which is done not just to look at the health system, it compares also education systems, monetary systems, banking systems. And Israel was actually ranked the 6th healthiest country in the world when this was done in 2017. Something which I'm sure you've heard in the past, and I'll give you a few examples, is medical research. If any of you have read the book, Israel, a Startup Nation, you'll probably find and remember references also to the health system in that. If you haven't read it, it's a book which is well worth reading. Basically, it's trying to explain how can such a small country as Israel be such a success story in numbers of Nobel Prizes, in startup companies and products that it's actually managed to launch worldwide when it's not in relation to the numbers that we are in the world. There's many reasons for that. One of the reasons being is the way that the Israeli public are, which is very much live for the day, live for today. You know, people are prepared maybe to take a risk also on the business side, and prepared to leave jobs in solid organizations in order to go after their own idea or to go after their own research. This is something that we also see very well represented in medical research. Medical research is actually over 50% of all of Israel's scientific publications. And we actually don't just publish, but we use this information to allow us to develop new pharmaceuticals and treatments. I'm sure many of you know that Teva, which is an Israel-based pharmaceutical company, is actually the world's largest production of generic medications. Again, Israel's a leader in stem cell research. We've already got trials going on to cure Parkinson's disease. There's another very big trial which is helping people rejuvenate their spinal cord after younger people have been in car crashes, accidents during their army service, and have become paralyzed. So we're actually quite forward in that. And as you've probably been hearing on the news, and we'll mention it afterwards, we're now actually the live phase 4 trial for Pfizer, and we're providing Pfizer with our statistics of what's happening in Israel following the coronavirus vaccinations, the COVID-19 vaccinations. And afterwards, near the end of my talk, I will mention that a bit. Now, the Israel healthcare system, it's easier for you coming from England to understand it than it is for many people coming from America. It's a system where all residents are covered, much like the NHS system is. The big difference is whereas in the NHS, it's basically one body giving healthcare coverage, broken down into numerous primary care trusts or GP surgeries. In Israel, there's actually 4 health funds. So every resident actually has the choice to join one of 4, as it were, NHSs. Now, to ensure that there's basically equality in what's given to people, each of these 4 healthcare services offers the same treatment. And there's basically a basket of healthcare services. Every year, there's a committee which decides which new treatments will go in. Every year, the basket of healthcare services is expanded. There's an earmarked budget which is put aside. And we've just actually had it published recently, what's going into the basket this year. And from the minute that the recommendations are published, every one of the 4 healthcare funds actually has to adopt and offer these services to all of its patients. This also ensures that there's no differences according to your postcode or where you live. So there wouldn't be a situation where someone living in a certain area could get access to a medication and someone in another part of the country wouldn't be able to do so. Now, how is basically the system funded? The system's funded from a few sources. One of the major sources is basically we all make from our pay slips, our paychecks, a national insurance contribution, and out of that national insurance contribution, a certain proportion of it, about 6%, is actually taxed at source and goes towards healthcare, and that's called the healthcare tax. It's on a sliding scale, as the more you earn, the more taxes you pay. So the payment is made according to what you earn and not what actually you take out of the system, which enables basically the system to carry on funding itself. On top of that, there's money that's put aside by the government specifically for healthcare, and that basically tops up the kitty of the money which is going to be available for the healthcare budget. That sum of money is then divided to the 4 healthcare funds according to their percentage of coverage. So if one healthcare fund has got 40% of the population, then they get 40% of the money. There is some adjustment for the age of the patients that they cover, whether they're male or female, and where they live in the country. But that's in their budget. And each health fund uses this money to supply care, to employ doctors, and also to pay for services that its patients will use from the hospitals. So we take out contracts, as it were, with the hospitals to do surgeries and to admit patients. If someone makes Aliyah, you get the first 6 to 12 months free of paying taxes for the healthcare system as an oleh. If after the first 6 months you've started working already, you do have to contribute like everyone else. If you're not yet working, you get an extra period of exemption. Now, again, what's important, it's much like in the NHS, it's not like a private insurance scheme, such as maybe PPP or BUPO, or such as you may see or be familiar with if you know the American healthcare system, is that there's no age limitation. Anyone can join, anyone can make Aliyah at the age of 99, 100, 101, and they're accepted. Again, there's no health limitation. There's no exclusion for pre-existing conditions. So even if you come and you're in the middle of a treatment for a cancer with chemotherapy, it can be picked up and it can be carried on here. Obviously, in these such situations, it's worth liaising first with a contact in Israel so we can arrange basically a smooth transfer and that there shouldn't be a break in treatments, but it's something that the person making Aliyah would be eligible for from the day that they make Aliyah. And for an oleh chadash, there is no waiting period. So you're covered from making Aliyah. A few days afterwards, your healthcare is activated. Now, if someone is a returning citizen to Israel or someone who was born to Israeli parents and actually already has status as an Israeli, then you do need to check it out with Nefesh B'Nefesh or your Aliyah advisor, because there might be a period of waiting if you're a returning citizen to Israel. Now, how does one decide which of the 4 health funds to join? As I mentioned to you previously, there's 4 health funds. The way really you can choose to join is where you're going to live is a big factor. Some health funds have much stronger penetration in different parts of Israel than others. Some really have a lot more of the Anglo olim. Maccabi was traditionally set up where I work and where I came when I made Aliyah, was originally set up by a group of doctors who made Aliyah from Europe and actually liked the idea of giving medicine in their home, in their private clinics, rather than in the more communal clinics, which was set up by the Klalit. And so to this day, a large number of doctors making Aliyah have joined Maccabi as doctors. And so therefore the Olim have followed them, because it's very important when you make Aliyah to be able to speak to a doctor in your mother tongue, and not just a doctor who can speak English well, but actually a doctor who understands your culture. And also it's a big help very often for a doctor understanding what it's like to actually make Aliyah, leave behind the place you've grown up, the place you've got memories and roots, and immigrate into another country. It's something which one could definitely do. I don't regret for a minute coming, but it is something that takes time to adjust. And sometimes if there's someone on the other end who understands your the stages that you're going through in your immigration into Israel, it's a big sense of help and support. So again, very often which health fund you join is going to be dictated where you're going to be living. If you happen to be going to live in a kibbutz in the north of Israel, where the health fund clinic on the kibbutz is Klalit, then it's worth you joining Klalit. Maccabi generally is very strong in the Anglo areas of Israel, in places such as Jerusalem, Ra'anana, Modi'in, in the Tel Aviv region, in the Tanya. And Markhed and Leumit have pockets where they're strong, generally in more of the ultra-Orthodox and very religious communities. That's really their hold. But again, if someone's joined a health fund and then they realize afterwards it's actually not the health fund that they want to join, you do have the option to choose to change. Twice a year, someone can change. We don't advise people every year changing twice a year, because it's quite important to get into a health fund and get for a doctor to get to know you, to develop a relationship with you, so you've got the continuity of care. But if you've made a mistake and you've joined the wrong health fund, you can actually change to another one. Now, I'm going to talk to you now because this is really the basic of how the system works, and I'll try and do comparisons to the English system so you can understand how it works while we're going along. What I've been talking about till now, what's paid for through your national insurance contribution, and which every citizen is entitled to, and which includes the basket of healthcare services, is the basic healthcare, the basic insurance, which every citizen in Israel has, and you choose which one of the 4 health funds you're actually going to take it through. Now, on top of that, there's another level of insurance called the supplemental insurance. This is something you may have heard of: Maccabi Zahav, Maccabi Sheli, Klalit Mushlim, Mu'chedet C. It's basically an add-on top-up, as it were, private insurance, which you can get through the health fund, and you take it through the health funds where you're a member. You can't, if you're a member of Maccabi, then take out Klalit or Mu'chedet's supplemental scheme. But also there would be no need to, because the schemes are actually very similar in what they contain. I'll give you a list in a few slides' time on what type of treatments are included in them. In a way, it can be compared to PPP and Bupa, but not quite. That's somewhere between our supplemental and our private, because it's something which is very much cheaper. I mean, we're talking for someone who, let's say, is in their 40s to 50s age group, something which is about 80 shekel a month. So something which is about 15 to 20 pounds a month. And again, it's something which you're not penalized for. You don't pay extra if you have pre-existing conditions, and there's no exclusion criteria. So they're not going to say, oh, well, you've had an operation on the meniscus of your knee, thereby we're not covering your knee. So it's a very affordable insurance. It's a top-up plan, and about 85% of the population actually have coverage with it. Now, the further level up, which are quite a small proportion of the population have, maybe 20–25%, is top-up private insurance plans, which generally people take out just for things such as transplants abroad, or choosing to have an operation abroad, or keeping their private plans in another country. For example, if someone's made Aliyah and their entire family is still in a foreign country, and let's say they needed to have a surgery, a hip replacement or something, it could be that they would choose to go back abroad to actually have this operation. Another thing I mentioned now is transplants. It's something which is always a dilemma and always comes up. As in most civilized countries in the world, there is a transplant list. And if someone needs a transplant, they go on that list. Now, it's not just a function of how long you're on the list, whether you would get an organ donation. It's also the situation, your medical condition. Because it could be if someone was in a worse condition with than you, and an organ came up, they would jump higher up on the list, even though they'd actually been there less time. So there are some people who will take out a private policy, which would enable them to travel abroad to places such as Turkey, other places in Europe as well, to actually do a transplant off list, as it were. These insurance policies won't allow you to jump the list in Israel, but there are countries that we all know about that will basically allow people to buy in to the organs in order to help fund the healthcare systems. Now, we're going back now to the basket of health, the basic level that I was talking about. That covers doctor's visits, blood tests and imaging studies, hospital admissions and surgeries, paramedical treatment, meaning speech therapy, physiotherapy, occupational therapy, seeing social workers. Dental care until the age of 18 or over the age of 75 is covered in the healthcare system. There are also certain other illnesses where you also get free dental care, such as having an oncological condition or if you have a genetic condition of the face, mouth, teeth, such as a cleft palate, also treatments will be free of charge in the healthcare basket, and mental health care, such as seeing a psychiatrist. Now, what's not included in the healthcare basket and is actually in the supplemental schemes, there's a subsidy form, we'll come to that on the next slide, is dentistry from those who are between the age of 18 to 75, optometry. By optometry, I mean eyeglasses and contact lenses. To actually go and see an eye specialist, an ophthalmologist, you can, and that is in the plan. So treatment for cataracts, glaucoma, and all the eye conditions that you're familiar with is in the healthcare plan, just not the purchase of contact lenses and glasses. And chronic nursing care also isn't actually part of the healthcare plan, and we'll address that later on in the lecture. Oh, I'm sorry, I've jumped a slide. Now, in Israel, much as you're familiar with in England, your primary care doctor or your general practitioner is your case manager. He is the gatekeeper of the system, and he helps direct you to the necessary specialties if you need basically another consultation. Now, in Israel, it differs remarkably to England, because in England, the majority of the doctors who sit in the community are actually the general practitioners alongside the practice nurses. Whereas in Israel, other specialties aren't only restricted to being in the hospitals, they are actually also spread out in the clinics. So what would happen, for example, is you get a cardiologist who would have his day job in the hospital, but then 1 night, 2 nights a week, he would actually sit in one of the healthcare clinics, very often in an area close to where he lives, and he would give consultations there. Now, this makes the system more efficient and allows better access. And it also, for the patients, because it means instead of taking a day off to sit in Northwick Park Hospital's waiting room to see a doctor in the cardiology clinic, they can actually make an appointment close to their home, and at 6:30 in the evening one day, they can actually go and see the cardiologist there. It also allows better cooperation and collaboration between specialists. So it means if I want to discuss something with a cardiologist or discuss a patient, I can actually arrange to be at the clinic at the same time, and we can do a joint visit, or we can actually just discuss the case between us. Now, most of the specialists actually require a referral of the primary doctor to them, basically to make sure that the system's used appropriately. Because very often a patient will take themselves off to a specialist who isn't actually the correct specialist for his problem. Someone might be short of breath, and the GP might realize it's actually a cardiac problem and not a respiratory problem. So it's important to go via your general practitioner. There are some specialties in Israel where you can go directly without a referral. Those include orthopedics, obstetrics and gynecology, ENT and dermatology, all of which can be found in your local healthcare clinics. Now, I mentioned to you before, I've explained to you how the referral works. Most patients see the specialists of secondary care in the clinics where their primary care doctor works. There are some situations where you'll be referred on to see a doctor in a hospital for what's called more tertiary care. That would really be in the question of oncology, hematology, things that actually need a multidisciplinary team which is coordinated in the hospital. If you are referred to the hospital, your health fund will give you a referral and what's called a hitchayvut, or a Form 17, which is basically an obligation of the healthcare system to basically treat you and cover also the financial costs surrounding the admission. Now, making an appointment. An appointment can be made. Most patients nowadays actually use the application to make an appointment. We have an app which is very, very user-friendly. There's an online, of course, on the computer, there's an online system that people can make appointments with their doctors. There's a 24-hour call center in all of the 4 health funds. There isn't one call center. You have to call your health fund's call center. And there's normally an option to basically press, in Maccabi, press 4 and speak to someone in English so they can help you if your English isn't good. Or of course, you can do it the traditional route. You can call the clinic receptionist in her working hours and you can make an appointment through her. Each of the 4 health funds also have internet sites which gives information on rights and benefits. They all have a section that's in English. There's also, on most of the sites, there's a personal healthcare record whereby if you go in with your own ID number and your special code, then you can get a reminder when you're due to do your next mammogram, when you may be due to do your next colonoscopy. If you're a diabetic, when you last did your blood tests, your HbA1c, your glycemic control index, and it's reminders, and it also allows you to make appointments for the necessary tests which you might be missing. We also have an interface where patients can request from their doctor sick notes, repeat prescriptions, or even a referral, or just ask a question. And every primary care doctor has access basically to this, this system of questions or online requests. And we're all required, we have an SLA, a deadline of the amount of time we need to basically respond to these questions. And the system is generally paperless. So if I'm needing to renew a prescription for my patients, they don't need to come and pick it up. I send it electronically directly to the pharmacy. The same if someone needs to do a blood test, I'll send it directly to the lab. The patient will go in, just give their ID number or their membership card, and the paperwork will actually be in the computer there. So we've very much gone to paperless. And also the health funds used to offer travel insurance. We still offer the travel insurance, but no one's really using it because we're not traveling anywhere at the moment. Now, another thing that's very helpful sometimes for people is on the application, there's GPS services location. So for example, you want to go to an emergency clinic, such as Terem, an out of hours clinic. It will actually help you navigate there. It interfaces with Waze. So you'll be able to get there conveniently, and it will tell you how long it's going to take you to get there. You can also see there's your personal health record. You can see there your lab results, compare them with those done previously. It has a medication list for you. It also has alerts and reminders, as I mentioned to you, when you need to next do your tests. And of course, we've added there a section if someone's had their COVID-19 vaccinations, when they were, what date they were, and also a link to the green passport, which we now have, which shows us that we're actually vaccinated and we would be exempt from going into isolation if we were exposed to someone who had corona. Now, in Israel, the doctors generally work in their clinic till about 8:30 in the evening. But of course, there's many hours until the morning where someone might need emergency care. There is a network of clinics in Israel that basically give out of hours services. Probably the one that you will have heard of is called the Terem clinics. They're mainly based in Jerusalem, but there are other Terem clinics in places such as Modi'in, Bet Shemesh, Bnei Brak. There's even one in Ashdod. And these are clinics which are manned by doctors and nurses. And if you've got an emergency situation in the evening, you can go and you can get advice and treatment from them. Of course, also there's emergency rooms. And if it's suitable, there's also a home visit. There's doctors from each of the health funds that will go to someone's house and see them if it's deemed necessary. What we do recommend patients to do is to call up the 24-hour helpline and to consult with one of our nurses there to see what is the preferable route for you to do. For example, if someone's got chest pain, we don't want them to go to an urgent care clinic in the community. We would prefer them to go directly to the emergency room, because if they do need to have a cardiac catheterization or intervention, we want them to be in the place to get to the cath lab as quickly as possible. But on the other hand, if we've got a young child who's fallen out of bed and may have fractured their arm, there's no reason for them to basically go to the emergency room. They can get a treatment at the urgent care clinics where there's a doctor there who will be able to put on a plaster if they're a plaster cast, if they've broken their arm, and also obviously x-ray facilities to diagnose what the problem is. We also have people who are requiring home care. That can be something which is done on a temporary basis or on a long-term basis. For example, there could be a situation where someone's had a hip replacement and it's expected they're only going to be incapacitated and unable to travel freely to their doctor's surgery for maybe the first month to 6 weeks after their surgery, because the whole aim of the surgery is to basically improve the long-term mobility of the patient. Or it could be someone who's permanently or long-term incapacitated and there isn't really improvement suspected. It could also be a patient with Alzheimer's who it's just very hard to take them out of the house because of the confusion and the disorientation it might cause. In such cases, we provide a team, just as someone would go and have a team of doctor, a nurse, someone to take their bloods to follow them up in their clinic, in their local surgery. Here we are basically allowing a situation where you have a fixed team of doctors, a doctor who will get to know you, a nurse, someone to take bloods, physio if needed, to come to the patient's house, and this is of no extra cost. Now, obviously, this system is something which is allocated on terms of need. It can't be I'll all of a sudden decide that I want to be in the home care team because it's more convenient, or I don't have a car and I don't want to go to a local surgery. It's something that has to be medical need to do, and not just something that I as a patient choose, because if I'm mobile, I have to go to my doctor's surgery in order to be treated. We have also other schemes which are going on. We have hospice care done at home, not just in the hospitals anymore. And we've also got, Israel's quite advanced in acute admission at home. We've started basically home hospitalization. We believe that the world is changing in a way where in the future we'll see many more of our patients being admitted not in a hospital bed in a ward, but actually at home. So we're starting patients, for example, who might have a cellulitis and infection in their skin and maybe need intravenous antibiotics. We're actually treating them at home, and the doctors and the nurses go and visit them daily, give them the medication up to twice, 3 times a day at home, but the patient stays in his home environment, in his bed, and we treat him there. Other diagnoses we've included in this are exacerbations of heart failure or chronic lung disease, and we're also collaborating with the hospitals in order to allow our patients to be admitted at home, because we really believe that's the best place for the patient to be. I mean, we've all also heard countless examples of people who have been admitted to hospital with one thing and actually come out, or during the hospital stay, been infected with corona because no one knew that the patient in the next bed to them at the time actually had corona. So I think what we've experienced in the pandemic in the last year is only going to strengthen our belief that the safest place for the person to be treated is actually at home, if it's something that's possible. In Israel, something which is very interesting, and I do remember it also existing to some extent in England, but it's a much wider and bigger scheme in Israel, is the mother and baby clinics. In Israel, there's a separation between well baby care, which is given basically by a dedicated team, not in the clinics in the community, but in other locations, to separate the well children from the ill children. And then in the community, we've got the general practitioners and the pediatricians who actually will treat the sick infant when he's not feeling well. So it's basically, again, it's a way of ensuring that we don't have contamination from one child to another, when one may be coming along for his regular vaccinations or nurse checkup, and another child's coming because he's got a virus, because he's got a strep throat or something like that. Now, these clinics give advice on nutrition, breastfeeding, child development. The child has regular checks there to check there's no developmental milestones that are being missed. There's advice that's given on safety in the home to prevent accidents, how a child should travel in a car with car seats, and of course they get their immunizations there. I mentioned to you before, if you imagine now we're jumping to the second level on the pyramid that I presented to you, the supplemental health insurances, which again, most of the country take out, even though it's optional. We've got 85% plus of the population actually with these schemes. There's no exclusion criteria. You can choose which level you're taking out. And the cost is dependent entirely on the patient age, not your pre-existing conditions. For a child, it's about 8 shekel, about £2 a month. For someone who's in their 40s, 50s, it's about £15 a month. And the maximum really is about 100 shekel a month, 110 shekel a month for someone 80 plus. So again, that's probably about £25 a month. There's very little difference in the benefits between the health funds, and there's immediate coverage for Olim who sign up to these schemes within 90 days of making Aliyah. So there's no waiting period. Sorry, I jumped. Examples of things which you might get in this supplemental scheme. Medications which aren't in the healthcare basket might be subsidized at 50% cost. You can choose to see off-list, basically, specialists. There's a list of specialists who aren't directly working with the health funds. They're generally directors or deputy directors of hospital wards or departments. and you can go and get a second opinion from them or a private consultant, and 85% of the cost will be paid by the health funds. You could choose to have a surgery in a private hospital, such as the Asuta network of hospitals or a Herzliya Medical Center if you're in Clalit. There's very heavy discounts on complementary healthcare treatments, such as tweener, medical massages, acupuncture, reflexology, chiropractic, osteopathy. For those people I mentioned previously who haven't got free coverage of dental care, those who are between the age of 18 to 75, there's subsidized dental care and treatment, including subsidized orthodontic treatments, even for adults, in the dental clinics, which are run or associated with the health fund that you belong to. Now, in Israel, I'm going to mention this very briefly. There is something which is called disability insurance. It's not something which is in the healthcare basket. It's something which you take from the government, from what's called Bituach Leumi, from the National Insurance Institute. And this basically is a stipend that would be paid to someone who is of working age, i.e. from 18 till the age of retirement, but is unable to work because of a healthcare problem. So these people would come between, in front of a committee of doctors, healthcare professionals, who would assess the medical condition and how it affects basically a person's ability to work. And if they felt that the person's working capacity was reduced because of a medical condition, then they would basically be given a monthly stipend, a monthly amount of money paid to them to compensate them for this. What's important to know in Israel is you can actually even be on 100% disability, but you can actually go out and get a job as well. So it's a system which basically encourages the person, even though you could be disabled, it could be that you could still go and get a desk job somewhere, and it wouldn't cancel the stipends that you were getting from the government, because we think overall it's much healthier for the person to integrate into society, and if they are able to work, then they should work, because it's much healthier for them psychologically in the long run. Again, nursing care patients. If someone's in need of medical care, as I explained to you in the home care team, a doctor, a nurse will come and visit you. But this doesn't cover the day-to-day nursing needs, the activities of daily living. For example, if someone can't bathe oneself, dress oneself, feed oneself, transfer from bed to chair, or toilet oneself, if 3 out of 5 of those cannot be achieved independently by the patient, they can be given a diagnosis or a label that they are in need of nursing care. In such cases, they will be allocated also from the National Health Insurance, either amounts of money that they can use to put towards nursing care. Maybe it can be used towards them going into a residential home, or the money can be transferred and you can be allocated hours of a carer coming into the home to care for the patient. So I'm going to say. Now I want to say a few words about Corona. Corona is something we can't switch on the news, of course, and without seeing it in the headlines. As you've all probably heard, Israel was one of the first countries to start the vaccination programs after England. You started first, but really we got ourselves going very quickly. As of today, more than 4.7 million of our population have been vaccinated. That's more than 55% of the population, of the eligible population. Until today, we've had approximately 780,000 patients who have had Corona, and there's unfortunately been 5,800 deaths to date. Thankfully, we've been in a situation where our medical system and the hospitals haven't been overwhelmed. We are still able to provide an intensive care bed for everyone who needs the intensive care bed. Hopefully now we're coming out of lockdown again. Things are on the way down. We've got 90% of our over 80s in the country have been vaccinated, which is something that we're very, very pleased about. We're seeing that it's reducing the numbers of hospital admissions. We're seeing it reducing the number of patients who are in serious conditions in hospitals. And those people who we're now seeing who have caught Corona after being vaccinated have had a much more mild course of disease. We have managed in our trials that we've been doing in our health funds in Maccabi, we've done it on on a significant number of patients, on 2 million patients already. We're seeing also that there's a 94% protection rate after having 2 vaccines, which is very close to what Pfizer was presenting in its trials. Of course, what we're going to have to wait and see, and something that worries us all, is what's happening with these new mutations, because the Pfizer vaccinations and the other companies' vaccinations as well, the Moderna and the AstraZeneca, were all built on the basis of the strains of the virus that were seen back at the beginning of the outbreak. And with these new mutations that are coming along, it could be that there won't be as good of coverage, but we're really going to have to wait and see. It's really quite known now, and the question is going to be when we're going to need it. I think it's quite accepted that we're going to all have to have a booster to ensure that we've got ongoing immunity. The question is going to be if it's going to be a year after the last round of vaccinations, or it's going to be 6 months. In Israel, they were very insistent that basically we vaccinated according to the protocol of Pfizer, that the second vaccination was given in a window of between 21 and preferably 28 days from the first vaccination. There were cases where it was prolonged to 35 days if the patient was in isolation or couldn't come for a reason. And they haven't done what I believe you did in England, whereby they decided it was correct to vaccinate more people with 1 dose on the expense basically of having 2 doses given at the recommended interval. You know, we don't really know what the answer is. There hasn't been enough time for trials to be done on all of the combinations of dose spacing, but I'm sure both decisions were based on evidence that was known to date. In Israel, we've been given, you can see here, and there's also something else which has come out, which is called a Tav Yarok, or a green certificate as well. From 1 week following the second vaccination, everyone was able to enter the health ministry site and download themselves a green pass. This green pass is basically going to allow the lockdown, which is being opened, has been opened on a number of tiers. It's been opened far more extensively for those people who have been vaccinated or have had corona themselves. For example, they will be allowed to go into gyms, swimming pools, hotels, leisure activities, concerts and things like that. Whereas someone who hasn't had 2 vaccinations and isn't a week after the second vaccination or hasn't had corona themselves won't be admitted to these leisure and extracurricular activities. So I hope I was able to provide you in that talk with, with a basic understanding of the Israeli healthcare system, and we're going to open it now for some questions.
Okay, thank you very much, Dr. Cardash. That was very, very informative. I just see that she's taking a quick call, so bear with us while she comes back online to us, and we'll ask as many questions as we possibly can with the time that she has available. If anyone else has any questions, please do feel free to submit them now in the chat. So
okay, sorry,
hi,
I'm back.
no worries. So I'm going to, we've had quite a few questions submitted. So the first one is from someone who's saying, from Joel Hagioff, saying that he has just booked some Chinese acupuncture through his healthcare provider in Israel, and he's just pointing out that they do alternative medicine as well. So is that
That's
something?
what, yeah, I mentioned that.
Right. So is that something
was mentioned
that all
in the
of the
supplemental healthcare? Yeah.
Okay, and that's something that they all do. Okay.
I mentioned that they do acupuncture, reflexology, massages, tweener, osteopathy, chiropractic.
We have another question here. Are patients registered with a specific GP in the same way as they are here in the UK?
Patients are registered. Patients can choose their GP. It's a much more flexible system. Generally, you choose which healthcare provider you want to go to, and you're able to choose. You're able to move between general practitioners. Also, if, for example, your general practitioner is away, very often you can see someone either in the same practice or in another practice. The system, it is recommended in the system that you have someone who is your primary healthcare provider, because there's obviously an advantage to the fact that someone knows you and knows how, knows your history, rather than you just going to anyone.
Okay. There's a question here that on the surface seems quite interesting. You've stated there's 4 funds or schemes. If the system is basically underwritten by taxes, your national insurance contributions, wouldn't a more unified scheme work better?
Well, that would be basically what the national health system is.
Indeed.
The whole advantage, there being 4 different health systems. I mean, it originally came about because there was one system which was very much a union-based system, and there was groups of doctors who made Aliyah, and they didn't want to be, as it were, part of the union. They wanted to be independent. But there is a lot of advantage to managed competition. If there's one healthcare system, there's not necessarily the need and to strive to improve and better the services you get, because obviously each health fund wants to attract more members to it, because the only way basically the health funds get their budget, get their money, is by increasing the proportion of the population that are insured by them. So there is a built-in managed competition system which ensures, I think, a high level of care. Yeah. And that's the basis of the system which there is in Israel.
Okay. Another question here. What extras do you get with the supplemental insurance?
I mentioned that was a slide a few slides ago. I'll show it to you again.
Just for the benefit of everyone here.
Here we go. Examples I gave you were medications which aren't in the healthcare basket, are subsidized, second opinions with specialists who aren't in the plan, as it were, but they might be recognized specialists, heads of departments in hospitals. You can choose to have a surgery. You might need an elective surgery in a private hospital with a private doctor. You can get discounts on the complementary healthcare treatment. That was where I mentioned the acupuncture, the reflexology, the chiropractor, the osteopath, and also for those who don't have dental care treatment free because they're over the age of 18 but under the age of 75, they can get subsidized dental care treatment here. There is also other services. Someone needs home heart monitoring, they can join up. A system whereby that over the phone they can monitor your heart rate, they can send you out someone to check you if you're not feeling well. They're examples of things in the supplemental system. Great,
thank you. Another question here: if one makes Aliyah as a retiree, i.e. so they're not paying into the national insurance through their paycheck, what health cover is available for them?
They have exactly the same healthcare, and someone who isn't basically earning anymore, they haven't got a salary, they will pay basically to the national insurance a sum of money. It's about 120 to 130 shekel a month, about 250 shekel for a couple. It fluctuates a bit with every year. So we're probably talking something in the realms of £35 each a month. That isn't just covering healthcare, that's basically covering all of your national insurance benefits. Now, if there is a situation whereby someone actually can't afford to pay that money, again, they won't be denied health insurance. They'll be means tested by a social worker, by someone, and if it's genuinely a situation where someone hasn't got the money to fund it, they will be granted basically healthcare without having to contribute anything.
Okay. Great. Another question here. You mentioned earlier there was a question about can people, are they assigned to a GP like we are here in the UK? Someone's asking here, what options are there for a patient to select a specific surgeon to perform their surgery?
Well, that's again, first of all, it depends what the surgery is. It depends if it's an elective surgery or an emergency surgery. We'll leave aside an emergency surgery because if someone goes in and they've got a burst appendix, well, they're going to have the person who's on call in the hospital to operate on to operate them on. Sure. Let's go to an example of a hip replacement. First of all, people can choose which hospital they want to go and have the operation with. They can choose to some extent, if they've met a doctor, an orthopod in the community, very often he will take his patients and he will operate on them. But there's another option, which if you have the supplemental healthcare insurance, you can basically choose to go to one of the options of private hospitals, such as Asuta or the Herzliya Medical Center. And you can basically have the admission covered by your health funds. And you could take the surgeon, that specific surgeon you want privately, and 85% of his fee would be covered by the health fund, and you pay 15%. And this option of taking a surgeon privately is also offered in the Jerusalem hospitals of Hadassah and Shaarei Tzedek. So you do have some ability to choose basically your surgeon.
Great, okay. And another question here. We've as I'm sure you know that our waiting lists for non-urgent treatments in the UK on the NHS have been adversely affected by the COVID pandemic. Is it the same in Israel? Have waiting lists for non-urgent treatments been adversely affected?
No, they haven't. I mean, there was a time in the first lockdown, yes, back when, if we're talking about back, let's say last March to April, May time, right, elective surgeries were cancelled. And yes, so people who were waiting could wait longer. But then what happened is after we got through that, and even now in the second lockdown, they've allocated separate wards and they've allocated separate emergency rooms for people who are coming in with corona, and they have allowed the elective surgeries and things to carry on going through. One of the main also reasons for being this, first of all, it's important to do so, and second of all, it's basically a source of income for the hospitals, which they couldn't afford to basically give up on, because the hospitals are funded by the money they get paid from the health funds for surgeries and patients' admissions, rather than the hospitals being actually funded directly by the government.
Okay. Some more questions coming through. And again, I apologize if you've already addressed this. Do people have to pay separately for medication?
There's a co-payment for medication. Most of the costs of medications are covered if they're in the health basket, such as about 85%. There is a co-payment. For example, a prescription for a month of blood pressure tablets could cost maybe between 15 to 20 shekel a month. There's not which is about £3 to £4. There isn't a fixed prescription charge as there is. So I could pay far less than a prescription charge for some medication, but maybe more for others. What there is, though, is a ceiling on the amount of co-payment that I pay for those baskets in the health system per month. So someone won't exceed, it's about 240 shekel. So even if you were to take 30 medications, as it were, once you got to the ceiling of 240 shekel a month, you wouldn't actually pay more per month for medications in the healthcare basket, even if it was a medication that may cost, thousands of shekel.
Okay. I've got another question here. Is it advisable to pay a sort of get to know your doctor visit as an Oleh Cardash, even if you're not sick?
Definitely, it's definitely worthwhile having an appointment. I ask my patients to have a double appointment, so I can come, I can transfer their medical records, I can make a medication list, because if they come the first time and they're not well, they generally haven't got the patience to tell me at that point in time what their medical history is, and I don't really know them. It's also an opportunity with the getting to know you visit that I can send them for baseline tests, to check that they've done regular mammograms, bone density, colonoscopies, and whatever's missing and they need to do.
Okay. Do you have time for a couple more questions?
Sure.
Okay. Yes. So I've got another one here. When making Aliyah, how can we prove that we have had both vaccines? Will we be provided with the green passport?
Well, what will happen is when someone makes Aliyah at the airport, basically, there are people from the health ministry checking, and if they see that someone has got a vaccination certificate, they will be given an exemption from going into home isolation. Once you have actually those the proof, your vaccination card with the name of the vaccine, the dates you got it, and the batch number, your family doctor can actually enter that into your medical record, which will take 24 hours, 48 hours to be recognized, and then you'll actually be able to get a green card out the system. So it might take a few days to go through, but we can enter it in. But you must come along with the vaccination cards showing what dates you had and the vaccine, which vaccine you had, and what were the batch numbers.
Right, okay. Just before I ask another question, I've had a direct message from someone you know here, Naomi Benson, who is saying hi, that she knows you from Kenton Guides.
Yeah.
So that's hi from Naomi. So let me ask you another question, Dr. Cardash. Someone else is asking here, quite a specific one. Are you covered for laser eye surgery if your sight is poor?
Laser eye surgery is one of the things that's actually subsidized in the supplemental insurances. You can get there. You can get basically, you know, a very, very significant discount in your in the cost of the eye surgery.
Right. Okay. And another question. A couple of like practical questions. For the first one is, do you need to have a medical before making Aliyah? And the second is, if you can answer them both at once, how do you transfer your medical records from the UK to Israel?
Okay, well, you don't need to have a medical before making Aliyah. Some places ask it, or ask a general background, just to make sure that that there doesn't need to be, as it were, a coordination of handover of care. They don't want someone to turn off the plane and all of a sudden say, oh, well, actually, I've got an active oncological condition, but there's no restrictions. So whatever is mentioned, basically, someone will be eligible for healthcare. Now, the way to bring it preferably is to have a PDF. You can also bring it, if someone wants, printed out or in a disk on key, but the best way to do it is have it in your email as a PDF file, because then what you can do is you can email it to us and we can attach it to your medical folder here in Israel. And then I can keep the record there. But it's worth having a printed hard copy as well.
Okay, and I think one last general question that we've got here is, what are our waiting times like at Israel's A&E departments, and what are waiting times like for elective surgeries?
I mean, it's a bit like saying
compared to the NHS, for example.
With an emergency room, it can very much depend on times of day. I mean, you can be seen as quickly as within an hour, and it could get to being a few hours. It's a very hard question to answer. Also, the emergency rooms are split up. Nowadays, we have a corona emergency room and we have a regular emergency room. We also have in the major hospitals a pediatric emergency room and also a separate emergency room area for oncology patients or for also obstetrics and gynecology. So it is quite streamlined. Elective surgeries, again, it's not waiting times like I remember when I was in England, you know, the waiting times that there were there. We're generally talking a few weeks to maybe 1 to 2 months, depending on what the strain is on the system at that point in time. Okay,
so sorry, I did say one last question, but if I could ask just 2 more, and then we'll call it a day. I'm asking one here from a colleague that I work with, so it's not worth my life's not worth it if I don't ask it. Is there any kind of scheme for people who don't live in Israel but visit often?
Now, there is a scheme for people who, it's hard to answer that question, I'll tell you why. For some, there is a non-resident scheme. Okay, there are a few non-resident schemes available, and some of the health funds actually offer one. Let's say someone's come for a year on a gap year, or let's say there's a situation whereby someone's come to Israel for the year and they don't want to yet make Aliyah. They want to decide if it's right. For those people who can anticipate being more than 3 months in the country, there is an insurance plan that you can join. Either you can do it through private insurance brokers, or you can, as it were, pay into the scheme, such as in Maccabi, there's a welcome non-residence plan, where basically you buy into the scheme. It isn't exactly the same. The way you access healthcare is the same, but you may be paying a higher cost if you've got pre-existing conditions, or you may even be told a certain pre-existing condition won't be covered. But that's less of a scheme which is suitable for someone going in and out the country. For someone, let's say, who's only coming for 2 weeks a year, twice a year, or 2 weeks twice a year, they're better to do it on a travel insurance scheme from the UK. These schemes aren't really set up for someone who's like the occasional tourist. They're more for someone who's in Israel for a few months minimum.
Okay, and I think we'll make this the last one now, quite a specific one. When we talk about prescriptions for people who suffer from an underactive thyroid and have no spleen, is there an option to have a free prescription for all necessary drugs? I guess that's a little bit like here in the UK. If you have a certain underlying conditions, then you don't pay for your prescriptions for any medications, regardless of whether it's specific to the condition or not.
Well, in Israel, there's different tiers of things. There are some medical conditions where you're exempt from payment for all of the medications. There's other medical conditions where you're exempt only from payment for the treatments connected to that condition. And then there's a third category of those who can't afford to pay will be given vouchers, which they can use in a pharmacy to allow them to cover costs, which is more of a social, basically, a social system. So there shouldn't be a situation whereby someone who is below a certain income level can't afford to have medication because they haven't got the money to pay. But your regular patient who's just got high blood pressure and can afford to buy his medication won't get his blood pressure medication free. But if you have HIV, if you have an oncological condition, then a large proportion of your medications will be without charge. Okay.
I keep saying that's the last one, but someone here has actually emailed in a question as well. It's very specific to Maccabi. So Maccabi, like the other Israeli healthcare providers, offers for additional subscriptions and benefits over the obligatory statutory requirements. In the case of Maccabi, there are two options, Maccabi Zahav and Maccabi Sheli. What are the benefits actually provided by these options? The gentleman who's posted the question has said that he's studied the online information, but he just cannot see precisely what is offered.
Okay, well, there are differences there. There are links on the website explaining in columns what's covered in it. There's actually a brochure there, which is called Maccabi Supplemental Schemes, and actually lists the comparisons. Generally, the big difference is the dental care, which is much more highly subsidized than the Maccabi Sheli. The Maccabi Sheli is more lifestyle changes. You can get in the Maccabi Sheli, you can get sessions very cheaply with a private trainer. There's a much larger discount if you wanted to have, let's say, laser hair removal, laser eye treatment. It's more, as it were, lifestyle things rather than the medical care, which is in the supplemental. But of course, everything in the Sheli, you have everything that's in the Zahav, the lower scheme, plus the extra lifestyle changes.
Okay, well, I think that was a very insightful presentation from you, and I'm sure a very useful one for many people in the audience. Dr. Cardash, you did mention earlier that you would share your email address.
Yes.
So if you could share that in the chat, that would be much appreciated. For those of you who are still with us this evening, we have some events coming up. The ZF are very excited about an exclusive interview that we've got coming up with the Israeli Health Minister, Yuli Edelstein. Details will be sent with the follow-up email to this webinar. That will be done at some point tomorrow. So do make sure to register for it. And so that's that event. We have a couple of very interesting events to celebrate the International Women's Day, which is on March the 8th. So again, I'll put details of all these events in the email that I send out to you tomorrow with a link to this evening's webinar. So again, on behalf of the WZO UK and the ZF in UK and Ireland, thank you very much, Dr. Cardash, for your time this evening and for your very valuable insight. And we hope that you get to see some of the audience in the future as your very own patients. And thank you to everyone in the audience for joining us. Stay safe, keep well, and keep an eye out for our future events. Thank you, everyone. Take care.
Thanks, Tanya.
Bye.
Oh. Very interesting. Thank you.
Thank you. You're muted.